Every mental disorder explained. What if the most complex thing in the known universe isn't a galaxy or a black hole, but the human brain? Every thought, emotion, memory, and decision comes from a network of billions of neurons working together. But sometimes that system doesn't work as expected. So today we're going to explore the fascinating world of mental health and explain the major mental disorders that shape the lives of millions. Chapter 1. What is a mental disorder? Before we discuss individual disorders, we need to answer one important question. What exactly is a mental disorder? A mental disorder is a condition that significantly affects a person's thinking, emotions, behavior, or perception of reality. Everyone experiences sadness, everyone experiences anxiety, everyone gets stressed, but mental disorders go beyond normal emotions. The key difference is intensity, duration, and impact. For example, feeling nervous before an exam is normal. Being so anxious that you cannot leave your house is not. Feeling sad after losing someone you love is normal. Feeling hopeless for months and losing interest in everything may be depression. Mental disorders exist on a spectrum. They can range from mild to severe. Some people function almost normally. Others require significant support. Scientists believe most mental disorders result from a combination of factors: genetics, brain chemistry, life experiences, trauma, environment, stress, physical health. There is rarely one single cause. Instead, many factors interact together. Think of it like a complex puzzle. Each piece contributes something, and when enough pieces align, symptoms may appear. Now let's explore the most common categories of mental disorders. Chapter 2. Anxiety disorders. Imagine your brain has an alarm system. Its purpose is to protect you from danger. If a lion appears in front of you, that alarm activates instantly. Your heart races, your breathing increases, your muscles tense, you prepare to fight or run. This response keeps you alive. But what happens when the alarm system activates even when there is no danger? That's where anxiety disorders begin. Anxiety disorders are among the most common mental disorders in the world. Millions of people experience them, and they come in many forms. Generalized anxiety disorder, GAD. People with generalized anxiety disorder experience excessive worry about everyday situations: money, health, work, family, the future. Even small problems can trigger overwhelming concern. The brain constantly searches for possible threats. What if I fail? What if something bad happens? What if I'm making a mistake? These thoughts may continue for hours every day. Physical symptoms often include muscle tension, fatigue, restlessness, difficulty concentrating, sleep problems. Many people describe it as living with a constant sense of dread, as if something terrible is about to happen, even when everything seems fine. Panic disorder. Now imagine fear reaching maximum intensity. Without warning, your heart suddenly pounds, you struggle to breathe, your chest hurts, you feel dizzy, your hands shake, you think you're dying. This is called a panic attack. A panic attack can feel so severe that many people rush to emergency rooms believing they're having a heart attack. Yet doctors often find nothing physically wrong. People with panic disorder experience recurring panic attacks and become terrified of having another one. Ironically, fear of panic attacks can trigger even more panic attacks. A vicious cycle begins. Many start avoiding places where attacks occurred: crowded stores, public transportation, restaurants. Eventually, normal life becomes increasingly restricted. Social anxiety disorder. Most people feel nervous speaking in front of a crowd. That's normal. But social anxiety disorder goes much further. People with this condition experience intense fear of judgment, embarrassment, or humiliation. Simple situations become terrifying: making a phone call, eating in public, meeting strangers, answering questions, giving presentations. The fear isn't just shyness, it's overwhelming anxiety that can interfere with education, careers, relationships, and daily life. Some individuals spend years avoiding social opportunities because the fear feels unbearable. Specific phobias. A phobia is an intense and irrational fear of a specific object or situation. Common examples include spiders, snakes, heights, flying, needles, blood, storms, enclosed spaces. The fear often seems disproportionate to the actual threat. Someone may know logically that a tiny spider cannot harm them, yet their body reacts as if they're facing mortal danger. The brain's fear circuits activate automatically. Logic becomes powerless. Agoraphobia. Agoraphobia is often misunderstood. Many think it simply means fear of open spaces. In reality, it's fear of situations where escape might be difficult. People may avoid shopping malls, public transportation, theaters, large crowds, sometimes even leaving home. In severe cases, individuals become almost completely housebound, not because they want to stay home, but because the outside world feels unsafe. Chapter 3. Obsessive-compulsive and related disorders. Imagine having a thought that refuses to leave. No matter how hard you try, it keeps returning, again and again and again. This is where obsessive-compulsive disorders begin. Obsessive-compulsive disorder, OCD. OCD consists of two parts, obsessions and compulsions. Obsessions are unwanted, intrusive thoughts. For example, what if my hands are contaminated? What if I accidentally hurt someone? What if I left the door unlocked? These thoughts create intense anxiety. Compulsions are behaviors used to reduce that anxiety. Repeated hand washing, checking locks dozens of times, counting, arranging objects perfectly, repeating phrases. The relief is temporary. Soon the obsession returns. The cycle starts again. Many people joke about being a little OCD, but true OCD can consume hours every day and severely disrupt life. People often know their fears are irrational, yet they feel unable to stop. Body dysmorphic disorder. Everyone notices flaws in their appearance, but body dysmorphic disorder takes this to an extreme. Individuals become obsessed with perceived defects in their appearance. The flaw may be minor or completely invisible to others, yet it dominates their thoughts. Hours may be spent checking mirrors, avoiding mirrors, seeking reassurance, comparing themselves to others. Some undergo repeated cosmetic procedures but remain dissatisfied. The issue isn't the body itself, it's the brain's distorted perception of it. Hoarding disorder. Most people collect items they value. People with hoarding disorder struggle to discard possessions regardless of actual usefulness. Over time, homes may become filled with newspapers, boxes, clothing, containers, broken objects. The clutter can become so severe that living spaces become unusable. The emotional attachment feels overwhelming. Throwing items away creates intense distress. Even objects that appear worthless may feel impossible to lose. Chapter 4. Trauma and stress-related disorders. The human brain is designed to remember danger. This ability helped our ancestors survive, but sometimes traumatic experiences leave lasting scars. The mind continues reacting long after the threat has disappeared. Post-traumatic stress disorder, PTSD. PTSD can develop after experiencing or witnessing traumatic events. Examples include war, assault, natural disasters, serious accidents, violence. The brain becomes stuck in survival mode. Symptoms often include flashbacks, nightmares, hypervigilance, emotional numbness, avoidance behaviors. A loud noise may trigger panic. A smell may bring back memories. A location may instantly recreate fear. To the brain, the trauma feels present, even years later. PTSD is not weakness. It is the brain's attempt to protect itself after overwhelming experiences. Acute stress disorder. Acute stress disorder resembles PTSD but occurs shortly after trauma. Symptoms can include anxiety, detachment, confusion, flashbacks, difficulty sleeping. For many people, symptoms improve over time. For others, the condition may develop into PTSD. Chapter 5. Depressive disorders. Everyone feels sad sometimes. Sadness is a normal human emotion. Depression is something entirely different. Imagine waking up every morning and feeling as though all color has disappeared from the world. Things you once loved bring no joy. Your energy vanishes. Your motivation disappears. Even getting out of bed feels exhausting. This is depression. Major depressive disorder. Major depression is one of the most common mental disorders worldwide. Symptoms may include persistent sadness, loss of interest, fatigue, hopelessness, difficulty concentrating, changes in appetite, sleep problems, feelings of worthlessness. For some people, depression feels like emotional pain. For others, it feels like emptiness. Some describe it as numbness. Nothing feels good. Nothing feels meaningful. In severe cases, suicidal thoughts may occur. This is why depression should always be taken seriously. It is a medical condition, not simply a bad mood. Persistent depressive disorder. Some individuals experience depression that lasts for years. This condition is called persistent depressive disorder. Symptoms may be less severe than major depression, but they last much longer. Imagine carrying a heavy backpack every day, not crushingly heavy, but always there, year after year. Eventually, people may forget what life feels like without it. Seasonal affective disorder. Some people's depression follows the seasons, most commonly during winter. Reduced sunlight appears to affect biological rhythms and brain chemistry. Symptoms often include low energy, increased sleep, weight gain, reduced motivation. As daylight returns, symptoms frequently improve. Chapter 6. Bipolar Disorders. Depression involves emotional lows, but what happens when emotional highs become equally extreme? This is the world of bipolar disorder. People often misunderstand bipolar disorder as simple mood swings. The reality is far more complex. Bipolar 1 disorder. Bipolar 1 involves episodes of mania. Mania is much more than happiness. It can include extreme energy, reduced need for sleep, rapid speech, inflated self-confidence, impulsive behavior, risky decisions. Some individuals feel unstoppable. They may spend enormous amounts of money, start unrealistic projects, take dangerous risks. During severe mania, psychosis can occur. Reality itself may become distorted. Eventually, mania often crashes into depression. The emotional contrast can be devastating. Bipolar 2 disorder. Bipolar 2 involves depression combined with hypomania. Hypomania is a milder version of mania. People may feel energetic, productive, and unusually confident. However, the depressive episodes are often severe. Many individuals seek treatment for depression without realizing hypomania is also present. This can delay diagnosis for years.